Hello to everyone watching me, all the dignitaries and all my fellow Indian students. I love you all. And I just landed back from Dubai to Moscow, and I got to know that I have to speak something about radiology to you all. So I had to be in Smolensk, but unfortunately could not. But still, I just hope that whatever I speak, that would mostly be based on my experience though, and to make you understand about radiology in brief. But I hope that whatever I speak would help you out, and if it does, I would be more than glad. So radiology, basically, it's quintessential, not just in my as in cardiovascular surgery, but also in neurovascular surgery, endoscopy, and so many things actually. So radiology is basically used for three purposes. First thing is screening. जैसे किसी को टीबी हो गई है, so you take the patient's family members and you screen them for the infection as well. So you do a fluorography or X-ray of the chest, and for lungs, tuberculosis, pulmonary cox. And for second thing is it's used for diagnosis and also to check the efficacy of the treatment that you're doing on the patient. So diagnosis as in you do CT, MRI for cancers, PET scans for cancer, and also to check the efficacy you can again post-op or during operation after the surgery or anastomosis you can check with ultrasound and all. And what else? Third thing, the most important thing nowadays, that is in operations, like we do hybrid surgeries, so interventional radiology that we call it. So for example, we as cardiovascular surgeons do open surgery, so it would be like taking out the superficial femoral artery, for example, and removing the plaque. And these interventional radiologists, they would just put the stent inside using this radiological technique. So it is of so much importance, and you have all the amazing radiologists around you, Olga ma'am, Daria ma'am. So just go to them and learn as much as you can, and try to understand why it's done, how it's done, and what to be done. So two basic pillars are there, how you choose for the five things that I tell you later in this video. Out of them, the method that you're going to use for the patient, that would depend on the two pillars, those thumb per one is the efficacy of diagnosis and also the method, and the second thing is how safe it is for your patient. For example, ultrasound you would advise for a pregnant woman as well, but you cannot advise other techniques. So you have to choose very wisely, you have to be very focused, and you have to be very concerned about your patient as well. And now the five things, the most common five things that you should know, I would just give you a brief, और थोड़ा बहुत मैं भी समझाऊंगा कि in my stream how it's used, or why it's used as well. So five main things are X-ray हो गया, एक तो हम लोग जो ordinarily करते हैं आपको पता है, ultrasound हो गया, MRI हो गया, CT scans और CAT scans, computer axial tomography, and the fifth and the most important thing, like for cancers and all, is PET scan, positron emission tomography. सो अब ये क्यों करते हैं, कैसे करते हैं, और इनके क्या एडवांटेजेस है, ये थोड़ा सा हम लोग देखने की कोशिश करते हैं. सो पहली बात तो हो गई कि इन लोगों को चूज़ क्यों करना है और कैसे करना है, ये मैंने आपको बता दिया. अब एक्सरेज जो होते हैं और सारे जो मैं आपको बताने जा रहा हूँ 5 टाइप्स, इसमें सारी जो चीज़ें का फ़र्क जो है, दैट इज़ अबाउट रेडिएशंस और द डिफरेंट things that goes in the different principle that is based on the functioning of these tests. So for example, X-ray अगर हम लोग देखते हैं तो X-ray is based on electromagnetic radiation. So electromagnetic radiation, and it's very minimal as well, X-rays. So X-ray आप करवाते हो, it's the most common one as well, and widely used. I think छोटे छोटे centers पे भी आजकल X-rays है. So for minor anomalies और जो भी चीज़ें आपको करनी है उसमें you can use X-rays. So X-ray again I told you electromagnetic radiation, तो एक plates होते हैं और आजकल safety plates भी आ गए हैं, so that can be used, and it's the first initial set of test, radiological test that you give to the patient. So patient को आप लोग जो concerned part है उसके लिए एक्सरे सजेस्ट करते हो, और फिर वो पेशेंट जाकर एक्सरे करके रिपोर्ट्स लाता है. सो व्हाई इट्स यूज्ड, एक्सरे मोस्ट कॉमनली इज यूज्ड, आप देखते हो हेयरलाइन फ्रैक्चर्स हो गए, या फिर ट्यूबरकुलोसिस एज आई टोल्ड यू, और स्क्रीनिंग हो गया फॉर टीबी और ब्रेस्ट लम्प्स, many different things. And फ्लोरोस्कोपी आजकल एक नया मतलब आपको पता होगा बेरियम एक्सरे मील्स जो हम लोग लेते हैं फॉर पेप्टिक अल्सर डिसीज एंड ऑल्सो एक्सरे विद बेरियम एंड ऑल वो भी करते हैं. नाउ द सेकंड थिंग इज अल्ट्रासाउंड which is one of the safest. Why? Because ये कोई harmful radiations नहीं use करता है. It's just high frequency sound waves that are used, and it's also that's why very safe and effective for patients who are pregnant. So what you do is you can use it in fibro scans for liver fibrosis. You can use it for pregnancy, in the trimesters. Every 2 months you can call your patient for an control, like a control screening. And what else? Ultrasound तो आजकल ultrasound guided biopsy भी होता है. So ultrasound again has a lot of use. And in my stream, cardiovascular surgery में, for example, nowadays we are not using general anesthesia for carotid endarterectomy. What we do is we just give Pravadnikova anesthesia, that means conduction anesthesia. So what we do is where there is the glomus, we say glomus, brachiocephalic artery glomus, there is facial vein, that is branch of internal jugular vein, and the 10th, 11th, 12th nerve, 12th nerve, cranial nerve, and also ansa cervicalis. So what we do is in different layers we infiltrate the anesthesia, or we conduction we do a conduction anesthesia from the platysma to the superficial layer. And through ultrasound before operation the anesthesiologist would just numb that part and we perform the operation. And now this ultrasound is not just used pre-op but also during operation. For example, agar kuch neurological deficit ho gaya, now the patient is complaining of EVM, or some less score in EVM in the Glasgow Coma Scale, so you can just do a controlled quick ultrasound over there itself, and you can see अगर यार कुछ anastomosis में problem तो नहीं हो गया, कोई thrombus तो नहीं है, या फिर कोई और issue नहीं है. अगर नहीं है तो आप लोग you can just proceed. And the third thing is also post-op में आपने operate करा है, stenosis कम हुआ है नहीं हुआ है, how effective the blood flow is, you can check everything through ultrasounds. And also in varicose operations that we do as in vascular surgeries, again it's very helpful. In varicose there are deep veins, superficial veins, superficial great saphena, and lesser saphena magna, and the lesser saphena, and the deeper ones are femoral, iliac, and all, and between them we have the perforant. So perforants तो हम लोग we remove it through mini phlebectomy, but though ये जो great saphena है and lesser saphena hai, that is in Russian Bolshoy Podkozhnaya vena and Malaya Podkozhnaya vena. For that you have to introduce a catheter, that is EVLO if you use a laser catheter, or radio frequency obliteration if you use a radio frequency catheter. So now to to locate the saphenofemoral junction and the entire length of saphena, and if the catheter is working properly or not, you again have to do this operation in control ultrasound only. So again, ultrasound is used for breast lumps, to study the progression of pregnancy, to also to diagnose the inflammation in the colon and all. You can also use ultrasound, or gastrological studies and all maybe you can use. Now the third, तो मैं severity के हिसाब से आगे बढ़ रहा हूँ. So now the third would be like a CT or a CAT scan. Here what we use is it's an ionizing radiation. So you have seen एक donut shape का एक machine होती है, and उसमें the patient goes inside, and there is a 3D imaging done. So CT in my practice we use it for अगर stroke के patient and all. So for the blood vessels angiological investigation we use CT with contrast, और अगर आपको नहीं चाहिए वो, so you can do a native, that is plain CT. So CT लेकिन it's like very strong on the patient, so you have to be very careful. तो उससे safer version is MRI because it's not using ionizing radiation. So what you do is CT scan, the scanner, but it's quicker, does it in 15-20 minutes. So अगर जल्दी कुछ करना है, stroke ऐसा आ गया, so what would you do? You have to go for CT scans. So CT scans usually they are used for diagnosis and for some assessing the severity of the traumatic injury, or some other problems in the patient. For also CT is used in guiding biopsies as well. to detect tumors. I think you all know CT scans for tumors and all. So itna basics are, you just have to get this thing. And iske saath saath you learn from Daria, Olga ma'am, and so many other people out there who are there to help you out. This is all that if I'm just trying to help you out to understand how to structureize the thing and understand radiology and how to approach towards it. So CT scan ho gaya. Next we have is MRI, magnetic resonance imaging. You all know about it. Now it's better, it's safer. Why? Because we are using magnetic field. So these magnetic fields rotate around. लेकिन इसमें क्या होती है, साउंड बहुत जोर से आती है. So sometimes patient can complain. तो आपको रुकना है and you have to ask the patient अगर उनको कोई problem हो रही है या नहीं हो रही है, and the patient can talk to the doctor about the transmitter, या मुझे कोई तकलीफ हो रही है या नहीं. आप भी उनको पूछ ही सकते हो वैसे. सो नाउ MRI इज बेसिकली यूज्ड फॉर सबसे मेन तो होती है स्पाइनल कॉर्ड के इंजरी, स्पाइनल कॉर्ड डिसीजेस, spondylitis, ankylosing spondylitis, different types of things. Also issues related to soft tissues, blood vessels, joints, say rheumatoid and all, maybe. And the most important thing in my practice, we use it in stroke patients. Aneurysm जो होता है, अब दो टाइप के एन्यूरिज्म होते हैं. सूडो एन्यूरिज्म वेयर देयर इज ओनली ट्यूनिका एडवेंटिशिया की स्वेलिंग, दैट इज यूजुअली सेकेंडरी टू ऑपरेशंस एंड ऑल. एंड एक होता है ट्रू एन्यूरिज्म, दैट इज ट्यूनिका intima, media, adventitia, everyone has bulged up. Now this falls, pseudo aneurysm is an emergency क्योंकि it can pop out, it can burst out. और अगर 500 ml से ज़्यादा का blood loss होता है, usually abdominal aneurysm, they are very serious. So there can be hemorrhagic shock and all. And the last thing is PET scan. इसमें क्या होता है, एक radioactive drug होता है, that is called radio tracer, that can be inhaled or that can be given through IV. फिर 1 hour के बाद में it goes through cellular level and detects about cancers. That's why it's very important. Or भी during bypasses we prescribe myocardial viability test, that is again a PET scan of the myocardium. So it is very effective in cancer diagnosis, and it's altogether like a very different and a very innovative technique. It's used in Alzheimer's disease के diagnosis में, in Parkinson's, in cardiovascular diseases as I told you, and cancers. So I hope कि आपको एक idea मिल चुकी होगी, and you are very well versed. I'm sure I am here to motivate you, to inspire you, but I myself get inspired from you all, and I'm sure you are great students. Show them how good you are. They all love you, and you also are a beautiful part of the new extended family of them and mine as well. So I love you all, and I'm proud and super proud of you all, and I'm sure that you would make me and Mother India and everyone around you proud, and would help everyone out there in the best way possible. Love you guys. See you again, or see you personally super soon. Bye bye. Love.